I came to medicine because I believe it is a liberatory tool. Do I think it's going to get us free all by itself? Absolutely not. But I believe having agency and autonomy over your body and the healthcare decision makings is a tool and a pathway to liberation.
I'm Martina, and you're listening to Natal. I don't know if y'all remember, after the Dobbs decision came down in 2022, a fear started to bubble up around period tracking apps. Were they safe? Should we stop using them? Would the feds use that info to come after people? While I got where people were coming from, I wasn't worried at first. I'd been using a period app for a few years, and I just loved the convenience of it all. But the more I scrolled on Twitter and Instagram, the more concerned I became. And because I don't put nothing past Uncle Sam, I deleted mine, just to be safe. But for folks who'd been working in reproductive justice, the threat of surveillance and criminalization were not new. In the decades since Roe, this right to an abortion had been steadily chipped away, narrowing the definition of who is protected under the law. Like the 1977 Hyde Amendment, which banned the use of any federal funds for abortion. And then there's the 1980 Harris v. McRae Supreme Court ruling, which upheld that states participating in Medicaid were not required to fund medically necessary abortions. And so when the Dobbs decision came down, it was an unraveling 50 years in the making, all happening in the palm of my hand. But let me be for real. This is a concern more nuanced than 140 characters. For today's episode, we wanted to bring together Dr. Jamila Perritt and Yveka Pierre for a conversation about the intersection of medical care and the law. You might remember Dr. Jamila. She's been on the show before. As a physician activist, she confronts the reality of Dobbs with her patients and colleagues every single day. And Yveka used to be a public defender and now represents people who have been criminalized for how their pregnancies end. She and Dr. Jamila have been working in parallel within the movement for years. They talk everything from the criminalization of abortion patients and providers to how their work has changed since Dobbs and the real tea on period tracking apps. What I love most about this conversation is how they reimagine a new future of care, one that affirms our dignity, our agency, and our fundamental right to privacy. And these days, it's their resolve to never stop building from the ashes that motivates me. Let's get into it.
Hi, my name is Yveka Pierre. I am the senior litigation counsel at an organization named If When How, Lawyering for Reproductive Justice. I use she, her pronouns. I am a lawyer, a Haitian woman, an immigrant, currently residing in the great state of Maryland.
And my name is Dr. Jamila Perritt. I use she, her pronouns. I am a board-certified obstetrician and gynecologist with advanced subspecialty training in complex family planning and reproductive health. I am based in Washington, D.C., which is the traditional land of the Anacostan and Piscataway people. Where were you? Do you remember where you were when the Dobbs decision came down? And how do you remember feeling in that moment?
I was at work. We were all on SCOTUS watch, and I think a lot of folks in Repro were also on SCOTUS watch. And so at If When How, we had written an amicus brief for Dobbs in the same way that we had written an amicus brief for June Medical, which happened like 2 short years before when that decision came down. And I think folks that were working in Repro knew what to expect. This was, I think, the first time that there was a leak of a decision, like it was a music album or something like that.
Yes,
it was kind of like negative Beyonce. Like there was a leak that nobody wanted.
the worst diss track
The worst diss track ever.
In advance.
And we're like, well, okay, this is probably going to be what this is. And there was Unfortunately, I think a lot of folks that have been working in this space knew that this was coming down the pike. We had all been kind of shouting that this could happen and not being taken as seriously as we hoped. Mm-hmm. But I think in the moment, I felt more like I had like a deep kind of sadness for folks that were going to come to a reality that some of us were expecting. And then because I had more lead time than I think the average person did, I felt more like, okay, we're in for a fight and we're fighting for people. But what about you? Like, how did you come to that moment?
I don't remember where I was. I'm sure at work too, which tends to be particularly because of the leak, where so many of us who, as you said, work in repro is spending so much of our time. So we really had been planning at Physicians for Reproductive Health for how to support our doctors on the ground in that moment. We knew that there were a number of states that had these so-called trigger bans. So once Roe was overturned, we knew that we were going to lose access in community for a whole swath of folks, not to mention the people who never truly had access under Roe anyway, but really sitting with that devastation. I also wasn't surprised, I think in part because of the leak, but in part because I've been watching what's happened over the last 20, 30 years in reproductive health care and in the space. But it doesn't mean that I wasn't saddened as well, right? Even with that lack of surprise, I think, for me, we can simultaneously grieve the loss of Roe and also in the same breath acknowledge that it was never enough. It wasn't designed to reach or to serve every person. And so I felt resolved as well, like, okay. And it feels a little bit contradictory or weird to say, but also a little bit hopeful.
Yeah.
Because for me, it also was a sign. I knew that folks who were not paying attention were going to start paying attention. And so I thought really in that moment, okay, well, now more folks are impacted by loss of access. Maybe we really will double down and fight this in the way that we need to in order to win. And so there was a little flicker of hope in that, because before it was just rural folks or young people or poor folks or BIPOC communities, right, who could not get access to care, or those who rely on the government for their insurance. But now everybody was impacted. So I thought, let's see how this goes. Let's see if we can really build the kind of coalition we need across differences to finally obtain the human right to determine how and if we build our family.
I think that's kind of that space that some of us were in. We're like, okay, now it's not just us doing the screaming, right? It's not
a theory. Exactly. And it's not a theory, right? Like, what if Roe falls?
And has fallen. What can we build from these ashes, right? Like, what can we seed here? What can we plant here? And I think that weekend was supposed to be a celebration weekend for me. And then the decision came down a day later. I had a case and somebody I had to get out of jail. So I had to get back to work. There wasn't, it was, a long ramp for mourning, So as a board certified OBGYN, how have your conversations with patients changed since Dobbs?
Well, primarily my work is in abortion provision. And so most of the people that I'm seeing are seeking abortion care, or, some are still making a decision, but for the most part, they've jumped through a million hoops to get into the office to see me. So they're already pretty sure about what they want to do. And so the conversation and the way that it's changed is really in terms of what folks are bringing and had to experience to be able to get to see me, to get an abortion or to get the pills or whatever that may be. And so the conversation and the experiences of the folks, seeing many, many, many more folks who are traveling over the last couple of years. And I've been providing this care for a really long time, and I have never experienced such exhaustion and anxiety and angst that folks are bringing in with them just to get medical care. Folks are traveling, they're driving with their kids in the car sometimes. Folks who may not have a job when they get back home, people who are traveling from multiple states. And so really just talking more and more about what their experience has been to be able to make it, much less having to walk through the throngs of protesters to even get in, to get
Which
care.
is so ridiculous.
Absolutely.
Find you some business.
Never, only others, only the business of others. So that really had a huge impact on the way that folks are showing up for the care, but then also the kind of space that we as clinical providers need to hold for people in a different way, because they have had such a complicated experience to get there. And it's not to say that we weren't providing care in a compassionate way before, but people need so much more now because the system has made it nearly impossible for them to exercise this human right. So, for you, I'd love to hear, as a member of the legal community, how prepared did you feel for what you're experiencing, the post-Roe aftermath? I mean, you talked about just a day or two later needing to get back to work to defend someone, to get them out of jail. So how prepared did you feel, and what did that look like for you?
So it's kind of a weird question, right? I feel sometimes like I'm part of the legal community, and other aspects I feel like I have a foot in both worlds, because there's not always this really great concentric circle between folks that work in repro and folks that work in the legal spaces. I think I was in a really unique position because I started at what was SIA legal team, the self-induced abortion legal team, back in 2018 when I had left the public defender's office in New York. And when I started working at SIA, people were like, girl, what you doing? What you doing with this? I thought you wanted a legal career where you got to litigate. This is not a thing that you're going to get to do any work. Like, what kind of impact are you going to be making over there? And then some of those same folks are kind of hitting me up and they're like, you know what is it they say all the time? You're doing the Lord's work when you're doing work that's hard and a little underpaid. And they're like, oh, I could never do that.
And stigmatized.
They hit you with the, I could never do that. But Godspeed, sis. Like, I get a lot of that.
Yes.
But I think I was in a very unique position because I was working at an organization that was already at this intersection, that was already doing that work. So before 2022, I was doing training for public defender's offices in different cities and different states, like trying to talk to criminal defense attorneys on how do you prepare your practice? What does this look like in your state? Doing a lot of legal analysis of what does the law look like, and future planning, forecasting, which is the worst thing in the world.
It is. It's intense.
It's silly.
And anxiety provoking. We don't know what's going to happen.
We don't know. We don't know the depths.
And the truth is, the work is still the work. Right. And so it continues to go on.
Yeah. And at the end of the day, like, the work is to make sure that people have what they need to get what they need. And no matter if you're doing that in the legal space or the medical or community organizing, that is the work, is that you use your skills and your privilege and your access to get people to build bridges so folks get from point A to point B. And at the end of point B, they can get closer to what they need and what they want.
Exactly. And it's tough, right? Because it's a little bit like whack-a-mole, because while we're helping each individual, one by one on a case-by-case basis, there still needs to be a concerted amount of energy turned to, you can argue for reform or revolution of this system so that we are not trying to catch up and create something for folks that should already be in existence.
And then there's that tension, right, of if you're a person that's client-centered, patient-centered, sometimes what is best for your client is removing doing system work out of the conversation.
Yes.
Because not everybody that comes to you to get an abortion is pro-choice. Some folks are, and you got to meet people where they're at.
Exactly. And people still need that care.
Exactly.
Let's, when you and I first met years ago, really at this intersection of care provision and criminalization. So I would love to talk a little bit about that. We often hear about abortion criminalization as it was the result or just began after the SCOTUS ruling in 2022. And I know I find that extremely frustrating.
Yeah.
What do you wish people understood about this history, both before, during, and after Roe, once we think about how criminalization shows up?
Ooh, when I hear folks say that, I think bless your heart that you have lived in a world where you haven't had to take in the harms that other people experience on a daily basis. And sometimes I'll get a law professor that's like a little bit radical, and then they'll let me talk to their law students. And the first question that I tend to ask is like, who here knows what the Hyde Amendment is? Who's ever heard of Harris v. McRae, right? And then that's how I enter into talking people through what did this look like during Roe? This idea that the fall of Roe is the start of criminalization. It's whack. Right. It doesn't go with the numbers.
It's not a thing. It just simply is not true.
It doesn't go with the numbers. It doesn't go with the case law. It doesn't go with the real lived experiences of, at now, over the last 40 years, millions of people. And what we have is that with 3 short years after Roe, there was the Hyde Amendment where they were like, oh yeah, you can have an abortion. We're not abridging that right, but not if you're getting any state-sponsored healthcare. And that cuts out a large swath of folks, right?
Exactly.
Then you get that upheld by Harris v. McRae. And Thurgood Marshall's dissent on Harris v. McRae is still one of my favorite pieces of reading because people think about it as repro, but it's really poverty law. It's saying that the people that are being like excised from access are people that are poor and do not have other options. Put that directly over criminalization. Those are the folks that we're still seeing criminalized and have been criminalized from Roe on, right? It's the folks that don't have access, that do not have privilege, that are closer to the possibility of being criminalized. And I like to remind people that Justice Alito was wrong, that at the start of this country, what nobody thinking about how do we criminalize abortion? Abortion was not criminalized until much later in this country's history. So criminalization looks different from how people think it was going to look. Criminalization looks like good law that prosecutors circumvent to try to figure out how can they punish someone for not experiencing pregnancy in the ways that they want them to experience pregnancy. So you had a miscarriage at home, we're going to charge you with abuse of a corpse. So you lost your baby during birth trauma after having the baby at home, we're going to charge you with murder.
Exactly.
For you in your work with PRH, what are some of the major challenges that you're seeing physicians are facing as a result of the Dobbs decision, or even outside of the Dobbs decision, the ways that we deal with abortion criminalization writ large?
I think to me, the thing that keeps me up at night that I am most concerned about in terms of the challenges that providers are facing on the ground really goes into the core of the dynamic when you're seeking care, right? This patient-provider or patient-doctor relationship. And what we've seen with the rise of criminalization that, as you said exactly, did not begin or end with Dobbs, but certainly is something that communities have faced long before that. What we're seeing, though, is that this has really been transferred into the healthcare space. Clinicians are asked to become arms and proxies for state violence. And when I think about the denial of care and criminalization, that is violent. And so we have to call that thing a thing.
Yeah.
It is violent for someone to be bleeding in your hospital and you be unsure about whether or not you can care for them because you may be prosecuted or you may go to jail. And so really undermining these core values that brought so many of us to medicine, right? I came to medicine because I believe it is a liberatory tool. Do I think it's going to get us free all by itself? Absolutely not. No more than I think that the legal system will get us free. But I believe having agency and autonomy over your body and the healthcare decision makings is a tool and a pathway to liberation. And so what we're seeing is a total breakdown of that. And now, instead of prioritizing the health and well-being of the person in front of me, the doctors in our network, and me included, are sitting at this crossroads trying to figure out, is it me or is it them? Do I give the person what they need in this moment, even if it's at risk to myself? Or do I compromise or deny them care in order to save myself? And that for me is terrifying. It is not the way I want to be treated when I'm seeking healthcare services. And it is certainly not the way that I want to treat anyone else. I think we should all be terrified by that dynamic, if nothing else.
And when you think about communities that already have a significant distrust of the medical profession,
Exactly.
it even creates more like fraughtness. It makes that more of a traumatic experience. And it almost feels like that's by design, right? To create that distrust.
It is. It is. None of this is accidental. And I think that's really clear. You talked a bit about how abortion had not been criminalized before, until recent history. And what we're seeing, like, we cannot disconnect the criminalization in care spaces from the work of capitalism, from the work of the prison industrial complex, from the work of organized medicine to discredit Black midwifery in the South, who are really the holders of this knowledge, including knowledge about abortion care.
Let's go, somebody.
So if we commit to a narrative to convince all those with the capacity for pregnancy that they don't know anything about their body. Actually, I'm a doctor. You need to come through me first. And don't trust the people that you know, you loved, you grew up with, you trust in your community. You should come to me because I am safer, I am smarter, I am more efficient, right?
Yeah.
This is the narrative that was being pushed to discredit midwifery. And it is one that has carried on as we're looking at the way that reproductive health care access has shifted and changed. And as we seek to examine, right, as Audre Lorde says, all of the repressive conditions of our lives, right, all of the ways that we are experiencing oppression and repression, including when we're seeking care.
I mean, look, I think part of that is to treat abortion and just like healthcare in reproductive spaces as if it's like new.
Exactly.
And that is also by design, by like being able to create a stigma around it allows us to get closer to criminalization.
Yes. And a system, right, where you have to pay for this care. No, you can't track your period. You must not know what's going on. You need to rely on me to tell you, right? So all of those pieces really play into it.
Hey, Natal fam! Tatiana Ali here, and I want to share something super special with you. I'm the founder and designer of Baby Yams, where we create handmade baby quilts with love, and all for a cause close to my heart. When you purchase Baby Yams, profits go straight to supporting Black and Brown birth workers who are on the ground making a real impact. With our partner organization, Birth Future Foundation, we've already awarded $75,000 in midwifery grants this year alone. And guess what? We've got exciting new holiday goodies on the site right now. So head over to baby-yams.com. And because you're a part of this beautiful natal community, be sure to use code NATAL15 for 15% off your purchase. Let's support each other and keep this movement growing. Now, back to the show.
So, when you look at the legal issues, what kinds of things are your clients coming to you with? And how has that changed over the last couple of years?
I only work on cases where someone is being criminalized for how their pregnancy ends.
Okay.
I have been trying to figure out a way to kind of truncate what my work looks like, and that is the best sentence that I've come up with. So my cases can sometimes look like someone experiencing a pregnancy loss and then being prosecuted for that pregnancy loss because their loss was quantified as being a crime instead of a tragedy. And that typically happens because of that person's status in the community that they're in.
That's right.
Whether they are poor, whether they're immigrant, whether they're gender nonconforming, whatever it may be, their loss being a crime versus a tragedy is usually, frankly, based upon their stigmatized existence. And then I have the other pot of cases where it's someone was not able to receive the care that they needed, either because of the abortion was too expensive, they can't get it, it's too far away, they don't have the money for it, whatever it may be, and they choose to have a self-managed abortion. Or some folks choose to have a self-managed abortion because they want to, not because the care was inaccessible, but that is how they wanted to end their pregnancy. And then they get charged either for the act of ending their own pregnancy, And we know that self-managed abortion is only on the books in 1 out of the 50 states, but somehow people still get charged for it. Or they figure out they can't charge them for self-managing their abortion. So they charge them with everything else around the orbit of the self-managed abortion. How did you get rid of the fetal remains?
Mm-hmm.
That's usually kind of one of the points of connection. And quite frankly, a good chunk of the cases that we become aware of come because people get brought to the attention of law enforcement because of the medical system.
Exactly.
Sometimes that happens because they have deeply held beliefs about pregnancy loss and ending pregnancies. And at times that happens because of exactly what you were talking about. Misunderstandings of requirements under the law, of whether they do have to report or not report. What do they report? How do they report? How do they chart? What do they write down?
Yes.
All of these things kind of lead to the cases that I become aware of. And my goal is always try to keep people from being arrested. If I don't learn about it then, and I can't stop that, trying to keep people out of jail and prisons. And now I think one of the biggest changes in the ways that I do my work in 2024 versus how things were before is the dawn of the Repro Legal Defense Fund. The fact that the RLDF exists and they pay for things like bail to get people out of jail when they get arrested. Like, I couldn't get a client out unless they were on an ankle monitor, but that ankle monitor would have cost them $700 a month and they were broke and couldn't afford it, and the RLDF would pay for that. Getting someone into therapy because that's really what they need for their safety, and being able to work out a way to get them access to that.
Yeah.
I think having resources has changed the way that I practice law and has made it a way for me to reach the goal of leaving people feeling seen and cared for by having had a connection with my org, with my staff, with the attorneys that I work with. It doesn't mean we always get the outcome that we want.
Right.
But I hope that folks always feel fought for.
And resources are really key. You know, Dr. Lynn Roberts out of New York has said, you know, the resources that pregnant people have or don't have fundamentally shapes the meaning of choice, right? As we're thinking about even the decision making and the work that we do in the world. You talked a bit about, you know, the ways that people are criminalized when seeking care. But I want to think a little bit about like all of the other ways, right? We know that healthcare settings and healthcare providers are not always safe places. We are not always safe people. But what about the community around you? And I'm thinking in particular about data and data mining and data privacy, right? I was thinking back to a report from NPR that really talked about the time immediately after the Dobbs decision in 2022, when we saw really more conversation around these period apps and cycle tracking apps, and knowing that some of them had, you know, tens of millions of users. We've heard a lot about these apps over the last couple of years and the data risk. I want to ask you, one, can you explain a little bit about what digital data is and how these apps may be contributing to the risks that folks are exposed to for criminalization?
So digital data is the zeros and ones that we create just by anything we do on our devices, phones, computers, whatever it may be. We're creating digital data when you go to a website and sit on it for a second, when you swipe on something on Instagram, when you're looking through Twitter, right? And all of these things are kind of stored and collected on your devices and can be accessed later. That being said, I just want to getting out my soapbox, unpacking it, putting it down.
Come on then.
I just want folks to know that is, I do not know of one case that has come from a period app investigation that leads to someone being arrested, because that's just not the pathway of how digital data gets used in criminal cases. My colleague Farah Diaz-Teo says hell is other people. And I think that is more how we see folks' digital data being used in cases. And I think it's usually what's happening is someone says something to a trusted friend, says something to a healthcare provider, says something to a family member. Sometimes they're in intimate partner violent relationships, and that partner then reports them to the police. And then when they are under investigation, there is a warrant that is issued for their devices, and then those devices are taken into the custody of the state, and then they go back through and backtrack to pick up what data already exists. That's when you're seeing them use Cellbrite to do a full extraction of your devices. They're using GrayKey to do a full extraction of your devices, and then they're putting the puzzle pieces together to try to support the narrative that they already have about your pregnancy loss to assist in your criminalization. Mm-hmm. I just want folks to think big picture about an app with 43 million users. Some of that data is like denatured in a way that you're not collecting cycle from month of October to user, 42,999,000,
Right.
That's not being connected in that way. Some police departments that I have had cases with don't even have their own digital security, digital data person. They have to send it to a state agency. That's not how resources are being utilized. I think what we're seeing is vulnerable people are closer to criminalization. People in their orbit bring them even closer to criminalization. And then digital data is being used to support their criminalization.
Makes sense.
If you need to track your period to help you live your life in a way that's good and safe, track your period.
Yeah. It's tough, right? I think a lot about that in the use of our own devices. Have you shifted? Has anything changed for you in terms of how you use digital tools to communicate, to support, or to care for folks in community?
It's kind of like the dark part of the work that we do. I think that there's more of a fear of like doxing, of data being used against you. And now in the legal spaces, of course, there's like more of a fear of like being subpoenaed and like having data used against your clients and things of that nature. So I think I am more likely to change how I communicate what is secure and what must be secured, and making choices accordingly. But how about you? Like in digital data, how does that feel for you as a medical provider working in the abortion space? And you're very kind of, ain't that many of us out here, so they know your name. So
No, they're not that many. I think, safety and security is always a primary concern for all abortion providers. And when you're living at the intersection of both racialized and gendered identity, so as a Black woman abortion provider, the threats of violence and harassment and the risk to me and my family is significantly greater. And so I am mindful of all of that in the way that I showed up. But I'm also, closer to 50 than I am to 25. And so, there's as someone who didn't grow up with these devices, it also isn't something that is super second nature to me. The concern that I have, even more than the risk of what's happening with our digital devices, is what's happening with our electronic medical records. And that's so much of the way when I think about digital data, that's where my mind goes in terms of concern. And because on the one hand, you talked about the way that this data is then used on the back end to facilitate criminalization, right? It is not often the initiator, but definitely is the facilitator. We know that healthcare providers are often the initiator.
Absolutely.
And so much of that initiation comes based on what we are documenting and how we are documenting it. So much of the work that we do at PRH is really retraining medical providers to understand what is critical to write in the know, what is harmful, what is protective, how you can really keep your patient safe, which is actually the goal of this, right? The goal is always, regardless of what someone shows up to see you for, is to keep them as safe as possible and to be aligned with them as part of the care team and the care model. Me documenting things in your medical record that can then be used against you to criminalize you or to take your children from you or to strip resources from you is not in line with care. It is not in line with safety. So really doing a deep dive on how we're writing, what we're writing, and why we are writing it.
Yes.
Who are we showing up for is critical.
And how does bias show up in what is chosen to be written down and where that's going?
Not even where.
Yeah.
Not where it shows up, because it absolutely shows up everywhere. It shows up everywhere.
So that being said, when we're kind of considering all of these new things that we're keeping in mind as our work moves forward, beyond your work, how have the past few years changed how you care for yourself?
There's so much that's happened in all of our lives over the last 2 years. Dobbs is only one piece of it, right? So for me, so many things have happened. I was diagnosed with breast cancer in the middle of a global pandemic, in the middle of a racial uprising, where hospital resources were depleted and unsupplied. And so that really, all of those things combined, and when you add Dobbs onto it and the stressors of work, really created a big shift in me in the way that I thought about care. For me, care was always something that I gave. It wasn't something that I was willing or able to receive from other folks. And so that is the biggest change, right? Allowing myself to be cared for and allowing myself to care for myself in the way that I know that I need has been the biggest change. And I believe that it is the only way we can be sustainable, not just in the work, which is important, but in our lives. And that's so critical.
Yeah, self-care is revolutionary.
It is. And it's not a spa day. And self-care is not going to get your nails done, right? Self-care is laying down when you're tired. Self-care is feeding your body. Self-care is going out and getting sun when you're able, right? All of those things are the ways that we care for ourselves. And you know, your role in the movement and in the work is certainly no less stressful than mine. And when you add to that, right, all of your identity. So for you, how does it feel to do this work as a Black woman in community with other Black folks, whether we're doctors or reproductive justice organizers? What has that been like for you? And what does it mean to you?
It's been an interesting few weeks to be a Black Haitian woman, I'll tell you that much. That's a really good question. I don't think I am succeeding quite yet at self-care. My husband reminds me about it all the time. Like, did you drink water? That is your third cup of coffee. Yes. Setting small goals for myself in the regards of self-care. But I think I find myself being the only face in a lot of rooms that look like me. And I think about the fact that Black women in the legal profession is like smallest percentage point. I think we're like less than 5% of the profession. And I think of how many Black women I see on the other side of criminalization, either being criminalized themselves or in the support role of someone else experiencing criminalization. I don't think that there is anything that I can do to make that less heavy. However, I think what has sustained me in all of the work that I do, because at the core of myself, I consider myself an abolitionist. I am working not only to break down systems, but to build new ones that look more like the communities we want to build. And I think I find community in small spaces. I find people that speak my language. And I'm heartened to see folks that look like me and come from the places that I come from and finding them in unexpected spaces. Like, I love going to conference and seeing you and being like, hey, I see you, you see me, we see each other.
That's right.
And those moments I think I truly appreciate.
Yeah, for sure. And, you know, I think as we come to the end of this conversation, and I know you and I can go on and on and on forever, I think it's always kind of nice just to think about, to dream, right? What is it that we're fighting for? When you think about the future you're fighting for, what does it look like? What does it feel like?
Ooh.
What does it taste like?
Ooh, we about to meditate in here. I think the future that I would like to fight for is one that actually looks like what reproductive justice is defined as, right? One where folks can live the lives that they want to live, decide how they build their communities, and be able to do that in safety and in abundance. Like, I think abundance is missing. We get tricked into thinking that there is not enough for all of us to get what we need, and that is a fallacy.
There is more than enough.
There is more than enough. I want to build a future of abundance where the earth gets what it needs, where the people on the spinning rock gets what it needs. And I also am accepting that I might not be there to see it. And that doesn't make me work any less hard. But what about you? What's the future you're fighting for?
It's similar, right? It is our ability to be free in this world, right? To be able to get the care we need in the way we need it from the people that we need it from or that we want it from. It is moving away from scarcity, right? Scarcity is a lie designed to divide. If you and I have to fight for these crumbs underneath the table, then the real question we should be asking is, how are they up there eating cake and we're underneath fighting for crumbs, right? So leaning deeply into abundance, and then especially in times like this, deeply, deeply into rest. And thinking about what that means, not just for sustainability in the work, right? Not so we can work harder or longer, but so that we can too be whole. I remind myself often that the future I'm fighting for also includes me.
Yes. Black people are in the future.
That's right. Well, this has really been a pleasure and an honor. Thank you so much for being in conversation with me. And I look forward to many, many more.
Yes, and thanks for spending some time with me. We should do this more often.
All the times. All the times. Sounds good.
To learn more about our guests, Yveka Pierre and Dr. Jamila Perritt, check out our show notes. A very special thanks to Arnita Rogers at the Center on Reproductive Rights and Justice at the UC Berkeley School of Law. Natal is executive produced by me, Martina Abrahams Ilunga, and Gabrielle Horton. Janelle B. Anderson is our lead producer, and Jordan McClenny is our production intern. This season was co-published and supported by the journalism nonprofit, the Economic Hardship Reporting Project. Visit natalstories.com for transcripts and more. You can follow us online at Natal Stories. Rate and review wherever you're listening.